patients will not infrequently come see me just as a second opinion regarding ablation. If they've already decided they want an ablation, but they're struggling with the literature on it, websites, chit chat with other patients. I tell you, the worst thing for me are other patients, because if another patient had a good result with whatever that procedure was, that's all they talk about. You must have a cryo. You cannot have anything but a cryo. You meet somebody else who didn't have a good cryo experience, they'll say, don't ever do a cryo. That's all nonsense. The literature's out there, and most of these procedures in good hands are comparable in paroxysmal AFib. Persistent AFib is a little different animal that we're dealing with. So I would say to anybody who has decided to have a procedure, ablation, who has paroxysmal AFib, don't get hung up on if it's somebody does cryo or somebody does radio frequency. Get hung up on who's doing it and what their numbers are and their success rates, and ask them. You sit there and say, how many of these things do you do a year? What's your success rate been? What's your complication rate? And if they're doing 20 or 30 a year, find someone else. I don't care who it is. And if they tell you they almost never get complications, find someone else. Because no one's God in this business, okay? There's no 100-0. And I have people sent to me sometimes who have been told this is a no big deal procedure. Guess what? It's a big deal procedure. I mean, it has risks, it has benefits, there's some serious complications. It is a big deal procedure. It's not open heart surgery, but it's still a big deal procedure, and patients have to be educated on the procedure. Now, there are certain circumstances where I simply know that there are some better people, and not necessarily even in my group, but in the country, to do some boutique type things. There are patients who have mechanical valves, and not everybody's comfortable doing a patient like that. So what you have to do is make sure that with your situation, whoever you're going to see has experience. And if you have persistent AFib, you've been in it a long time, sometimes just isolating the veins isn't enough. And that's where you really need to get a sophisticated person. So I wish I could tell you exactly what you should do. I would tell you that sometimes asking that question to your electrophysiologist won't get you anywhere, because if they're preparing to do your ablation, they're not necessarily going to say, hey, Bill down the road is who you should see. I mean, let's be honest, if you're going to buy a Mercedes, the Mercedes dealer is not going to say, hey, by the way, did you check out the Porsches down the road before you buy my car? I mean, let's be reasonable. But you can find out. I mean, you can take a search. You can see some additional things. And you could go to places like the Heart Rhythm and just make sure you get a second opinion. So let's say you're not sure. What should you do? It's your life. It's your procedure. And you're just not sure. Get a second opinion from a different group, and then compare and see what you want. But above and beyond everything, make sure your operator is doing a sizable number of these every year, more than 50 a year, and has good results and good complication results. That's the best I can advise you without specific instances.